This is Rachel Garcia, and I will be discussing topic about influenza. Influenza is also known as flu, the grippe. It is an acute viral infection affecting respiratory system caused by influenza virus. Back in the 1918, Spanish flu or H1N1 has killed a lot of people. And then H2N2 in Hong Kong, which is also known as H2N2, has killed about 1 million people. In 2003, the avian flu H5N1 has about cross-species transmission from the birds to human. And in 2009, swine flu or H1N1 produces drug resistance. And by 2013, another strain of avian virus H7N9 infected the world, okay, and affected the world. So flu basically has vaccine for seasonal flu, but for the rest, still there is no vaccine available for us. Influenza, it is a common infectious disease under the Orthomyxoviridae. There are a lot of species affecting us with flu. So under the type A, we have the wild aquatic birds, which is considered as the natural host of large variety of type A influenza. And occasionally, viruses are transmitted to other species and may then cause devastating outbreaks in domestic poultry or give rise to human influenza pandemic. If you may recall, last year there was a massive killing of ducks in the area of central Luzon, particularly in Pampanga, in the fear that we may be able to transmit the influenza or the avian flu. Influenza virus A can be subdivided into different serotypes based on the antibody response to the viruses. H1N1, which caused sponge flu in 1918 and swine flu in 2009. We have H2N2, which caused Asian flu in 1957, and H3N2, which caused the Hong Kong flu in 1968. And we also have H5N1, which caused the bird flu in 2004, the H7N7, which has the unusual zoonotic potential, H1N2, endemic in human, pigs, and bird. The H9N2, we also have the H7N2, which is the other type of avian flu in 2013. Then we have also the H7N3, H10N7, H7N9, which is rated in 2018 as having the greatest pandemic potential among the type A subtypes. We also have H6N1, which only infected one person and recovered. Next is the influenza virus type B. Influenza virus nomenclature came from a Fujian flu virus. This genus has one species, influenza B. Influenza B almost exclusively infect human and is less common than influenza A. The only other animal known to be susceptible for influenza B infection are the seals and the ferrets. This type of influenza mutates at a rate of about 2 to 3 times lower than type A, and consequently is less genetically diverse with only one influenza B serotype. We also have the type C influenza. This genus has one species, the influenza C virus, which infects human, dogs, pigs, sometimes causing both severe illness and local epidemics. Influenza C is less common than other types of influenza and usually causes mild diseases in children. Moreover, there is what we call influenza D. This genus has only one species, influenza D virus, which infects the pigs and the cattle. The virus has potential to infect human, although no such case have been observed. That's why it's not included in the slide. The mode of transmission for influenza. So there are animal sources basically that can be potential, okay, reservoir that may transmit the microorganisms from from the poultry to their products down to their products, infecting human. And there is also a possibility that it can be transmitted from man to man as well. So by direct contact, by droplet, okay, so that can also be transmitted from man to man. Now, how do we diagnose influenza? Viral culture is the confirmatory test for the influenza. However, certain serologic influenza requires paired acute and convalescent sera, so does not provide results to help the clinical decision making. We can also do rapid antigen testing, reverse transcription polymerase chain reaction, and other molecular assay can identify presence of influenza viral RNA in respiratory specimens in very high sensitivity and specificity. Immunofluorescence assay are antigen detection assay that can generally require use of fluorescent microscope to produce results in approximately about 2 to 4 hours with moderate sensitivity and high specificity. Rapid molecular assay are new kind of molecular influenza diagnostic test for upper respiratory tract specimens. Rapid influenza diagnostic test or antigen detection that can detect influenza viruses within 15 minutes. However, in most cases, if we are experiencing common flu or seasonal flu, we just do simple serologic test and identify the signs and symptoms or the clinical symptoms of the patient. But in the time of pandemic, that's the time that we do certain viral culture to particularly isolate what virus infected the individual. What are the flu signs and symptoms? So basically, you have your fever, or sore throat, and dry cough, and runny nose, stuffy nose, muscle pain or body malaise, headache, fatigue, and some people may have some sort of vomiting, diarrhea. Though this is not common among children, this is more common among children rather than in adults. It is very important to note that not everyone with flu will have fever. So sometimes the immune system is strong enough to fight febrile episode, and there will be instances that you have only upper respiratory signs and symptoms. Now, as nurses, how do we care for people with flu? Basically, the care for client with flu is somehow similar with that of the client with viral pneumonia. We also have ineffective airway clearance or problems with the breathing pattern, because there are instances that the nose is congested because of the rhinitis, and then there will be instances because of the sore throat. They have this difficulty of swallowing, they do not have good appetite. So you take into consideration concerns of increasing fluid intake and risk for volume deficit because of the fever episode. They also have muscle weakness, so we can identify problems on activity intolerance. So the care for this will be basically supportive care. So whatever the signs and symptoms are, you can provide care to alleviate the signs and symptoms. So let's say, for instance, we have ineffective airway clearance. So we can provide client with steam inhalation to soothe feeling and um, allow liquefaction of secretion. We can do chest physiotherapy, provide soothing drink for the sore throat, like the ginger tea, warm ginger tea. And then we can also provide small but frequent feeding with high caloric and high carbohydrate, high protein diet to uh, sustain the energy of your client. You can put the client on bed rest to reduce oxygen demand and to prevent increase in metabolism. And we can also allow the client to take some citrus fruits, which can be a source of vitamin C as well as fluids. We can also provide our client with increased fluid intake, or under doctor's advice, we can hydrate client intravenously, provide paracetamol as ordered. Okay, so those are the things that we can do to our client as nurses. So as mentioned earlier, the management for flu is supportive, intensive supportive care, since client has a viral type of disease. There is no specific treatment for the disease. Antiviral is recommended as early as possible as per doctor's advice if they are hospitalized. Um, there is high severe complication for clients who seek hospitalization, but at a general rate, um, flu is often manageable at home. Okay, so that ends our discussion for the flu. I will see you in my next topic. Bye.